then you would want a waterproof barrier to put on.
Like a chuck? Or, is that what you're talking about? Like a chuck?
Hmm?
Like a chuck?
Yeah, like a chuck. You know?
What are you looking for?
Yeah.
Oh, it's that step. You have together, like in the middle. No, you have to push it in the middle, like together. Because if you do one side, then it'll like just do one.
Yeah, it's the other. You need the other one. Professor, there's the other one.
All right. Here,
It's the one next to it.
That's easier.
Technical difficulties.
So you want to kind of lay his head back so you can see the area. This, by the way, is an abdominal binder. So,
I didn't know what you would do.
would you wrap over this way and just kind of firmly wrap that way? It's on. So, if we're going to do the dressing, you want to release the binder. These here are Montgomery straps, and if you're going to be changing a dressing frequently, they're nice to put on because you don't have to keep taking tape on or off the patient. These have adhesive already attached to them that you can attach to the skin, and then when you open up the dressing, all you have to do is untie it here, and it opens up. So to remove that, you would put on disposable gloves to remove the dirty dressing. You just have to remove this from one side, and you change this if it got soiled or whatever, depending upon how much drainage is coming. Okay, so that's what that is. So, with your disposable gloves, these are huge. Even the disposable ones, not the ones obviously that come in the kits, but the others come in usually small, medium, or large. So one that isn't quite so big for you. So you want to. If you're using Montgomery straps, you would undo that. If you were using, if it was taped down, you would remove the tape, and you can use some moistened saline to help remove the tape if necessary to get it off. And then you would remove your soiled dressings. And in this case, as you can see, there's a ABD pad. There's some 4x4s, and there's also some dressing in the wound that's been packed with. And this is like the wet to dry. What goes in the wound is wet. So you can take all of that off and dispose of it in your bag.
You take it all off at once?
Huh? Yeah, you can. You don't have to do it. This, the underlying, you may need to do more.
They packed it.
Depending upon, you just have to feel if it's sticking or not. You may have to moisten it some more to take it off. Oh, this would be going in.
Yeah, those
the
are
back.
like gauze that was packed in.
You would take that packing stuff out too, right?
Mm-hmm.
Okay.
Sometimes it may come out with everything else, but you don't have to peel off each individual thing. You take whatever comes with it. So you gently remove the soiled dressings, moisten saline. Then, of course, you want to note your wound. Right, so what do you want to note about it?
It's color, depth, drainage.
Odor, if there is any.
Right, the condition of the skin around it, if you notice any granulation tissue, depending on how deep the wound is.
You measure it.
Any signs of infection? Huh?
You measure it.
And you measure it. So you would need a little, either some tape or some way to measure it. There may actually be something.
I saw the nurse put her finger in it and then measure it kind of with her finger and then put it up to like a measuring tape.
Yeah, sometimes, once you're sterile, but I'm not sterile.
I don't think she was sterile. That was in the video you can watch.
Yeah.
Yeah, she was like, I'm a second shoes, and she's like, oh, and then she sticked it in again, and it didn't look pleasant.
Well, this is the trouble with using the internet, but at least you kind of got a feel for
Yeah.
what it looked like or whatever.
Even
So,
though it's wrong.
Not too.
and sometimes also with chronic wounds, sometimes you find they're not quite as strict as with, because especially the ones that are already so contaminated and everything, but it's a good idea to use as much sterile technique as possible. Okay, so you get all of that off. Drainage on the so you notice, whatever drainage is on the dressing or whatever. If it's a large, it might just be a fairly clean surgical incision, sutured, but it might be a big, a large wound as well, maybe a pressure ulcer or whatever. So you would note all of those things. And if it's a pressure ulcer or a deep wound, you see if there's granulation tissue, signs of healing. If there's any necrotic areas, they'll look black. The undermining and tunneling and everything, and that's once you get the thing open, you can do that. So when you have that done, then you would remove your disposable gloves, put them in your receptacle as well. Right. Okay, so then you're going to open your supplies and dressings. I'm not sure what all's in here, so.
Professor, what's epithelialization?
That's, the epithelial is the outer layer of your skin, so it's like kind of that growth over, like the last stages of healing, you see that as it grows over and starts to.
So that's after granulation.
Yeah.
Good sign.
Yeah.
Pathophysiology, we learned about it.
Do we have one of these kits as well?
Yes. But I'm not in here, so I'm gonna look,